Hi, this is Dr. Tim Conley, and in this brief lecture, we will be discussing the substance alcohol. Substances included in this class include those that are made by fermentation, sugar containing fruits and grains, such as beer and wine, 3 to 8% alcohol by volume. And for beer, and then 11 and 13 for percent ethanol for alcohol. Spirits are produced after distillation and generally contain at least 30% alcohol. You can double the percent and have what's commonly referred to as proof. So something which is 30% alcohol is 60 proof. Fairly common is 80 proof, 40% alcohol. Something can get be about 95% pure alcohol, after which it starts evaporating, but and that can be called white lightning and various illegal products because their concentrations are just so harmful. A bewildering array of alcoholic beverages is available for consumption. Standard alcoholic drink is about 6.6 fluid ounces of alcohol, 12-ounce beer, 5 ounces of wine, 1.5 ounces of distilled spirits will generally do that. And that's important in defining what a standard drink is. If somebody's trying to estimate, if I drink this much, my blood alcohol level will be that much, playing that sort of chart of what, how much alcohol can I drink and what blood alcohol level will I have. Standardizing that is important. Just a quick note on blood alcohol levels. 0.08, that's 0.8% of your blood. If that's alcohol, you're legally drunk pretty much every place. 0.05 plus impaired driving gets you some places. 0.10, over the limit. 0.20, and you're getting drunk. 0.30, you're an individual's very impaired. Blood alcohol in excess of that, up over to 0.40, 0.50, 0.5%, proves fatal. People will go into an alcoholic coma. And it all depends on how much you drink and how fast. An individual who's arrested for driving under the influence with let's say a 0.35 blood alcohol level, that wasn't their level when they hopped in the car. They wouldn't have been able to start it. Some people drink as they drive down the road, or they'll have 3 shots for the road before they leave the bar, and as they're driving down, their alcohol level is going up. They fall asleep at the wheel. Little drunk driving stuff. Historically, alcohol is been around forever. There's references to it in ancient Chinese Middle East literature as far back as 9,000 years ago. People were fermenting grapes, wine for a long time. It became such a problem in the United States. It was alcohol use was legally restricted with what was called the Volstead Act, the 18th Amendment to the Constitution in 1917, 1919, and then it was repealed in 33 with the 21st Amendment, making it legal to drink. But that's when alcohol sales became really regulated by the states. You had to have a license in order to sell it. And efforts were made on the part of the state. It was a supply side, control effort. If we control the amount of people who can sell it, we should be able to control the amount of drinking. Don't forget, just do the reasoning. Why would the United States pass a law outlawing alcohol unless it was a big problem? And from historical timelines, you can see there were temperance movements. It really was a public health problem. People become dependent on this drug and proceed to develop tolerance to the point that it will kill them. Lifetime exposure to alcohol is about 88%. Sooner or later, almost everybody tries it. You can see all the statistics in your textbook. I would point out that clinical studies on alcohol use have led to the idea there are several types of alcohol use disorders based on how it presents. There were the classic were type 1 and type 2 forms proposed by Cloninger. I'm more leaning towards, I'm a Baber guy. Thomas Baber came up with type A and type B. Your type A has a later onset of alcohol-related problems. I think it was called type A because it's a more common type. The alcohol use disorder age of onset's over 25 years old. Tend to not have childhood problems, relatively mild issues, fewer hospitalizations, et cetera, et cetera. Type B, less common, early age of onset, lot of antisocial delinquent behavior, family problems, etc., and a more, it's not in the text, but a more rapid onset of high tolerance. Some people seem to develop tolerance for high blood alcohol levels at a very early age, which makes them prone to withdrawal, which makes them prone to want to avoid the withdrawal, so they drink more. Now you have somebody who's in an addictive state. The alcohol is a central nervous system depressant. When you first drink it, there's a period of disinhibition, sort of giggliness, behavioral arousal. People are, doing and saying things that they ordinarily wouldn't. They find it novel. They like to do it. It relieves anxiety. People with anxiety disorders often turn to alcohol to try to solve their problems. Increased talkativeness, et cetera, et cetera. As drinking continues, you'll get an emotional outburst. You will get someone who is not a fun drunk, but a belligerent drunk. Enough alcohol and it becomes sedative, hypnotic. People will pass out. They'll fall asleep. But on the way, they may display violent behavior, et cetera, et cetera. They'll fight it, particularly in males. You can see a lot of hostility. Chronic unhealthy use of alcohol over a long period of time can result in what's called Korsakoff-Wernicke syndrome, or Wernicke-Korsakoff. It's associated with deficiencies in nutrition. People drink to the excess of eating. It becomes a priority for the body to get alcohol out of it. It's a toxin. It'll kill you. Your body knows that. Your brain knows that. It will devote all of its liver resources, all of its digestive system resources to eliminating the substance, to the exclusion of digesting food properly and providing you with the vitamins that you need. Basically, your liver goes into overtime trying to get rid of the stuff and doesn't do the other jobs that it should. That over time results in nutritional deficiencies to the brain, impacting the memory system. So you get what's called anterograde amnesia. People will not be able to remember stuff moving forward. New things can become very chronic. Alcohol is generally very tough on other organs throughout the body. Let's see. The neurobiology I wanted to comment on a little bit. A widely accepted tenet of addiction research is that these substances, anything you take, produces a pleasurable effect. It's pleasurable, so you do it again. That it's a positive form of reinforcement. Why do you do it? I do it because it feels good. Initially, people do it because it feels good. Eventually, they do it because they don't want to feel bad when they don't do it. This applies across substances. The initial effect is rewarding. Maybe it takes away some pain. Maybe it produces an elevated emotional state they can't get any other way, so they do it because of the reward. Eventually, they're taking it because they're sick if they don't. That's withdrawal. I don't think that's covered particularly well in the book chapters, but withdrawal and withdrawal avoidance are a big reason why some people use. Alcohol it's highly ritualistic. It's served in bars. There are sitcoms like... there's sitcoms about it, Norm's Bar and Cheers, etc. And there's social rituals that go along with it. People become habituated to that as well. It becomes a habit. One important point made in your book chapter is that all drugs, including alcohol, affect reward pathways by enhancing the release of dopamine. I don't want to go into a whole bunch of neurotransmitter stuff, but I would say that starting way back in 1970, it was 1970, the involvement of endogenous opioids, or endorphins, which are opioid receptor sites in the brain. The word endorphin, by the way, comes from morphine. Endorphin is the name of a particular neurotransmitter in the brain involved in both reward and pain relief. It's named after morphine. Endorphin, morphine. Write the two words together and you'll see the similarities. It was so named because when scientists initially studied, hey, where does this morphine go? When does an opiate go when it goes into the body? They were able to chemically trace it to a particular site in the brain and say, here's where it's going. Well, we're going to name that a morphine receptor site, but we'll call it endorphin. because endogenous means it comes from within. The morphine that comes from within is called an endorphin. Now, the role of alcohol in that, and boy, I grew up with this theory. It was dominant in the 80s and 90s. Acetaldehyde would undergo a metabolic reaction to form tetrahydroisoquinolines that were structurally related to morphine. And that was kind of all the rage. It's somewhat of a controversial theory. There's been some inability to replicate those findings. But alcohol does increase the release of certain opioid peptides like endorphins in rat pituitary glands, etc. There's still a lot of support for it. And sometimes you can confirm the diagnosis by treating it. And if you treat a person with alcohol use disorder, an alcoholic, with naloxone or naltrexone, which are opioid receptor site, they'll occupy those opioid receptor sites, craving goes down. So in some way, alcohol is involved in the endorphin system in a way that results in craving. Two really important concepts here: tolerance and dependence. They are diagnostic criteria for DSM-5. You have increased amount of the substance in order to achieve effect, or a decreased effect with the same amount of use. Simply put, the person takes 2 drinks, they get the effect that they want to. Eventually they take 2 drinks and it's like, I'm not getting the effect that I got out of 2 drinks. I'll have a third one. That's tolerance. I'll have a fourth one. So it takes more to get the same effect. Dependence, well, there are 11 diagnostic criteria for dependence in DSM-5. But if we talk about physical dependence, the concentration of alcohol required to produce sedation increases. It goes up over time. Keep that in mind. One main feature of alcohol use disorder is a strong desire or craving for alcohol. Bouts of heavy drinking often follow periods of abstinence, even when the symptoms of alcohol withdrawal have long subsided. So stay with this. Then you get an individual who's not drinking to avoid withdrawal. They get through what is essentially an extended hangover. That's withdrawal. It can get, by the way, medically very severe. It can kill you to withdraw from alcohol. But a person gets through the withdrawal. They may go weeks, but they drink again. That craving, that is a result of a long-lasting permanent change in the brain system, and it's very difficult in a treatment setting to coach people on how to cope with the craving that is finally a symptom in DSM-5. It was not, by the way. If you go back into earlier editions of DSM, it did not include craving as a symptom, but because craving as a phenomena has been pharmacologically validated, it's now included. So there are long-lasting, even irreversible changes in mechanisms regulating drinking behavior, which is why it's a chronic disease. Individuals are prone to relapse, and they must be engaged in some sort of treatment-related behavior or activity pretty much ongoing. It's one of the reasons the 12-step programs work so well. Ever a reminder that your brain is going to try to sabotage you back into using. I know that's a lot to digest. It is a very serious disorder. I'm not going to go into all the medical complications. I'm going to trust that you covered that in your book, but almost every organ system, skeletal, brain, liver, heart, some cancer risk goes up, especially in women with alcohol, heavy alcohol use. Be sure to note that there are some beneficial effects of alcohol associated with light to moderate drinking. The popular press loves to pick up on that. Drinking's good for you. Drink 2 glasses of wine a day, every day, etc., etc. Okay, if you don't drink more. But pretty soon those 2 glasses don't have the same effect emotionally, physically, etc., that they had before. It takes tolerance. It takes more. Most people who drink 2 drinks a day on any kind of a regular basis are going to progress and drink more. They kind of leave that out of the articles because heavier drinking than that over time has extremely negative effects. So generally, the negatives are not worth the positives that you get, despite what the wine magazines tell you. Be aware that heavy alcohol use in pregnancy leads to a variety of what's called fetal alcohol spectrum disorders. There's a lot of material on FASD. It results in body dysmorphia, which is a child which is born with peculiar abnormalities in the face, very identifiable. It's diagnostic, actually, but also, microcephaly, low IQ, etc. It's associated with drinking during pregnancy. There is no safe level, a limit for alcohol consumption in pregnancy. There, you have alcohol. Understand alcohol dependence, you will understand dependence on nearly every other drug that we're going to cover in the course.